The new cover story in Consumer Reports out this morning is called "What You Don't Know About Your Doctor Could Hurt You." The magazine reveals how, quote, thousands of doctors across the U.S. are on medical probation for reasons including drug abuse, sexual misconduct, and making sometimes careless, deadly mistakes. But they're still out there practicing.
In one case in California, Consumer Reports says that an OBGYN was placed on probation for 40 cases of negligence and incompetence, including removing the wrong ovary. Yet he was allowed to keep practicing, and he did not have to disclose his probation to his patients. Our Dr. Holly Phillips joins us at the table. When you hear that story, you go, that doesn't make any sense.
Sure, that definitely sounds like one that fell through the cracks.
So you're saying Consumer Reports, it's very difficult to find out your doctor's history, medical disciplinary history. Right. Consumer Reports wants to change that. How?
Yeah, so they've put together an advocacy group. They have a number of things on their bucket list, but at the top of that list, they want something called the National Practitioner Data Bank to be open to the public. Now, this is a data bank. It's managed by the Department of Health and Human Services, and it's a huge repository of all types of information about healthcare providers, not just doctors, nurse practitioners, physical therapists. And you can find information about medical malpractice suits or disciplinary action that the providers may have been involved in.
Is it true that a very few percentage of doctors are responsible for most of the malpractice?
That is true. In fact, 2% of practicing physicians are responsible for most of the medical malpractice. But here's what's interesting about that, Charlie. It doesn't necessarily mean that those doctors are bad doctors. For instance, doctors who are more likely to get sued are those who dive right into the most difficult cases, those who are willing to take cases where there are no other options that may not have a good outcome, and other doctors will turn down. There are doctors who will only take simple cases where they know that they'll have success, and therefore their records stay clean. If I'm choosing a doctor, though, I want the doctor with the most who's willing to take the most difficult cases.
What about the probation? I mean, that headline that I read sort of stands out when you hear sexual misconduct and,
sure,
careless mistakes. Why shouldn't that data bank be open so people can at least see that and have that information?
Sure, right. Transparency is really very much a buzzword of the moment. And this data bank does have some of that information there. And it's not open to the public. Doctors can see it, hospitals can see it. Of course, the medical board can see it. They use it to make decisions about licensing. But the public does have access to information about doctors, about their disciplinary history, their licensing, where they're credentialed, and they can find that right on the websites for the state medical boards.
But those can be difficult to maneuver for some
Yeah,
people.
and Consumer Reports rightly points out that some of the websites for the state medical boards really aren't that easy to navigate, right? The information may be there, but finding it and going through some of the legalese there isn't always easy.
So what's the best solution to this?
I do think that patients should be armed with information, but as the AMA states, that information is only useful if it's accurate. The database may not have the most accurate information. It's best to rely on the state medical boards. And also, if you're choosing a doctor, go with intuition. A big part of intuition is communication. We see medical malpractice claims, medical malpractice cases are much lower when patients feel like they can talk to their doctor, and most importantly, when they feel like their doctors are listening to them.
Thank you.